All right, so we'll continue with the blood vessels. Now, if you look at the arteries of the thoracic and abdominal regions, you've got a lot of stuff going on here. So you got to think, okay, here's the heart. It's going to pump blood to the aortic arch here. Okay, then you get the brachiocephalic, left common carotid, and left subclavian right here. Okay, off the brachiocephalic, you get the right common carotid and the right subclavian. But as you work your way down, you can get bronchial arteries, esophageal arteries, the mediastinal, the pericardial arteries. Okay, then you go thoracic aorta, then you have a left gastric artery, the splenic artery, a common hepatic artery, which is for the liver, superior mesenteric, make sure you know that one, the abdominal aorta, the gonadals, you have lumbar arteries, okay, you have an inferior mesenteric, then you have a common iliac artery. If you have any injury to that, you have minutes to live. Internal iliac. So the larger the artery, the less time you have to fix it. Okay, very simple. Now if you look at this, this is a great thing. You don't have to technically memorize all this, but it does allow you to understand the blood supply. So here's the thoracic aorta. So if you go back here, that's right in here, the thoracic aorta, and all these branches that come off the thoracic aorta and the abdominal aorta here. Okay, and here's the abdominal aorta. So what are the arteries that come off the thoracic aorta? Well, you got bronchial arteries, pericardial arteries, esophageal arteries, mediastinal arteries, and then what they supply. You have intercostal arteries and superior phrenic arteries that supply this area. Then as you work your way down here, the abdominal aorta, you're going to get inferior phrenic arteries, the adrenal arteries, renal arteries, and most of these are named for what they supply, right? So a renal artery will supply the kidneys. The gonadal arteries will, obviously, if you're a man, testes, and for females, ovaries. The lumbar arteries will supply the lumbar spine. Where you want to understand is the celiac trunk is very, very important, and because that supplies, look at this, the left gastric artery does the stomach, the splenic artery does the spleen, stomach, and pancreas, and the common hepatic artery does the liver, stomach, gallbladder, duodenum, and pancreas. So the celiac trunk has a huge influence on the blood supply to your GI tract. So any injury to the celiac trunk would cause problems with the stomach, spleen, stomach, liver, gallbladder, pancreas. So keep in mind that the celiac trunk plays a vital role in providing blood supply to the GI tract. And the superior mesenteric artery gives rise to the appendix, the small intestine, the pancreas. Inferior mesenteric is the last third of the large intestine. So great little diagram. And then, of course, you can go further along. So the left common iliac and the right common iliac, they're paired. So you're going to see the same thing that this pairs on the other side, follows patterns similar to right. So basically the right external iliac, right internal iliac will provide blood supply to the pelvic muscle, skin, viscera. The superior gluteal will supply blood to the hip muscles, the joint, the obturator to the hip and thigh muscles, the internal pudendal, the rectum, anus, and the lateral sacral to the skin and muscles of the sacrum. Here's the major arteries serving the upper thoracic and upper limb. And you're like, oh my God, this is like, but if you look at this, okay, here's the heart. The left ventricle will pump blood into the aortic arch, and you get that brachiocephalic trunk that comes off first. And your right common carotid will branch off first. Then your right subclavian will give rise to the right vertebral, the right thyrocervical, and then the right internal thoracic, your right axillary, then it'll break into the right brachial, which will break into the radial and ulna, and then the digits, right? And then veins will intertwine here, and then the veins will return all the way and back through the superior vena cava. So again, do you have to memorize everything per detail? Not necessarily, but the blood flow is important to know from where it's going. Just to say, okay, if you had damage to the brachiocephalic trunk, then you would have issues with a lot of these. And I'm not going to be too hard on the arteries because this is still relatively new to you, but just have an idea of the major vessels in the body. Okay. Major arteries serving the lower limb, femoral, popliteal. Again, the femoral artery is huge, but look at all the things that come off the femoral artery: the deep femoral, the medium femoral circumflex, the popliteal, then the anterior and posterior tib. The veins work the same way. A lot of times they're named the same. They're just put a V on them, so they're veins. So there's a femoral artery and femoral vein. There's a popliteal artery and vein, radial artery and vein, ulnar artery and vein, etc., etc. Okay, so this is just another same thing as I showed you in the arteries. Now it's just all the veins. Same thing here. Okay. Now the aorta and its major branches. You have the ascending aorta, aortic arch. You have the brachiocephalic, left common carotid, and left subclavian. So make sure you know which three branches come off the aortic arch. And then the descending aorta, the thoracic aorta, and the abdominal aorta. Varicose veins. If you have a family history of varicose veins, then you may have varicose veins as well. Systemic blood pressure. The graph shows the components of blood pressure throughout the blood vessels. So again, the aorta has the highest blood pressure, then the elastic arteries, and if you can see, the veins have the lowest blood pressure. Okay. What are some pulse sites? Well, you can feel your pulse at the dorsalis pedis, the posterior tibial artery, the popliteal artery, the femoral artery, the radial artery, the brachial artery, the common carotid, facial, and temporal. So these are all great places for you to test the artery. Most commonly, you'd probably do it the common carotid and then the radial artery here. Probably don't recommend checking the femoral artery, the popliteal artery. Not only is it places that you probably can't easily reach, maybe it's not convenient. So radial artery and the common carotid, of course, are the two easiest. Arteriosclerosis can result from plaques formed by buildup of fatty calcified deposits. So if you have a diet heavy in red meat, cholesterol, eggs, then this plaque will start to build up. Again, keeping everyone moving and not being bedridden is the only way to get the blood out of your lower extremities. So the veins that have valves rely on muscular contraction to return the blood supply. Okay, the capillary exchange, you have arterial end with a net filtration pressure of plus 10 milligrams of mercury. So fluid exits capillaries since capillary hydrostatic pressure 35 milligrams is greater than the blood colloidal osmotic pressure. So it's just a pressure gradient. Okay, so because the pressure is higher, you're going to have that going in. Area of high concentration to low concentration. So in capillaries, there's a net filtration pressure of 0 milligrams of mercury, so no net movement of fluid since capillary hydrostatic pressure is about 25 milligrams of mercury. Okay. So you see how fluid exits capillary, hydrostatic pressure 35 milligrams of mercury is greater than the blood colloidal osmotic. So it goes from high concentration to low concentration. Okay, so you have high concentration here, pressure, and there's lower pressure here, so it's going to go. Now, if you have fluid re-enters capillary, since capillary hydrostatic pressure 18 milligrams is less, so you have higher pressure here, lower pressure here. Remember, it goes from a high concentration to low concentration, so then pressure is going to come through there. So that's basically how the capillary exchange of oxygen and carbon dioxide take place. It's just a pressure gradient. Again, hormones involved in renal control of blood pressure in the renin-angiotensin-aldosterone mechanism, increasing angiotensin II. So you're thinking, okay, what's going on here? Again, in our class, we're going to just kind of focus mostly on we're not really going to go into the kidneys and the hormones too much. So this is just telling you the long-term and the short-term effect of blood pressure. So let's say you have decreased blood pressure and or volume. Well, in the short term, your sympathetic division is going to say, okay, adrenal glands, you're going to release some epinephrine and norepinephrine. So when your blood pressure is decreased, then the sympathetic says, okay, well, I'm going to increase my cardiac output and then increase peripheral vasoconstriction. Okay, then that way your blood pressure goes up and then you're back to homeostasis. In the long term, so that's just short-term fix. In the long term, your kidneys will produce renin, and the renin will go in and activate angiotensin II. And then what's going to happen is your antidiuretic hormones release, aldosterone is secreted. And if that's the case, then you get cardiac output, peripheral vasoconstriction, blood pressure. So a lot of times, blood pressure medications can work this way. Okay. And then if you have EPO, which does increase red blood cell formation, then your blood volume increases and homeostasis is restored. So there's the short-term and the long-term way that your body will keep your blood pressure at bay. And medication along this lines right in here can definitely help. If you have decreased blood pressure and volume, what about the endocrine mechanism? And then there's a neural mechanism as well. Let's say you have decreased blood pressure, your baroreceptors and chemoreceptors will say, oh, wait a second, what's going on here? Your cardiovascular centers will say, what's going on here? And then your sympathetic is say, okay, well, you know what? We're going to increase our cardiac output. And in doing so, our peripheral vasoconstricts, and then your blood pressure increases, your venous reserve goes down, and homeostasis is recurred. So without you thinking about it, your whole job of your body is to keep everything at homeostasis. Okay. Now the interaction of a circulatory system with other body systems, there's a huge amount of interactions. So let's talk about the digestive. Well, the role of the circulatory system is to absorb nutrients and water, deliver nutrients to the liver for processing by the hepatic portal vein, provides nutrients essential for homeostasis and building hemoglobin. The endocrine system, the skin, carries clotting factors. The muscular system, of course, provides nutrients, oxygen for contraction, removes lactic acid and distributes heat generated by contraction. Muscular pumps aid in venous return. Exercise contributes to overall cardiovascular health and helps prevent arteriosclerosis. How about the nervous system? Produces CSF fluid within the choroid plexus, contributes to the blood-brain barrier. Cardiac and vasomotor centers regulate cardiac output and blood flow through vessels via autonomic systems. And the respiratory and skeletal system provides blood for critical exchange of gases. Skeletal system provides calcium, phosphorus, and other minerals critical for bone matrix. So you can see that the circulatory system plays a huge role in all these systems and is probably one of the most important systems that you have in your body. There's the pulmonary circuit again. Just to review, this is probably the 4th or 5th time that we're going over this, but the superior vena cava and the inferior vena cava will bring deoxygenated blood into the right atrium, through the tricuspid valve, through the right ventricle, through the pulmonary semilunar valve, through the pulmonary trunk, pulmonary arteries, where gas exchange will take place. The hepatic portal system, which is the liver. The liver receives blood from the normal systemic circulation via the hepatic artery. It also receives and processes blood from other organs delivered via the veins of the hepatic portal system. All blood exits the liver via the hepatic vein, which delivers the blood to the inferior vena cava and back to the heart. Fetal shunts, the foramen valley in the intraarterial septum allows blood to flow from the right atrium to the left atrium. The ductus arteriosum is a temporary vessel connecting the aorta to the pulmonary trunk. The ductus venosus links the umbilical vein to the inferior vena cava largely through the liver. So remember, the blood supply is usually supplied from the mother. So in the baby itself, it skips the whole pulmonary circuit. Okay, that's why you can have deoxygenated blood mixed with oxygenated blood, because that's where gas exchange will have to take place. Okay, when the baby takes its first breath, the foramen valley, which is the hole in the heart, will shut and the lungs will inflate, and then everything will start on its own because it no longer has mama to breathe and exchange gases. All right, good work.